Hi, I'm Christina.
I'm Eileen.
I'm Clarissa.
I'm Crystal.
And I'm Jonathan, and we're doing a project on
HIV.
So, epidemiology. More than 1 million people are currently living with HIV in the United States, with approximately 50,000 new cases occurring each year. In North America, HIV is most prevalent among men who have sex with men. However, increasing numbers of new HIV infections are occurring in women, people of color, people who live in poverty, and young adults. And then on to geographic location. The highest percentage of HIV diagnoses in the South, Northeast, and Midwest is among Blacks and African Americans. Hispanic Latinos have the highest percentage of HIV diagnoses in the West. Going back to the South, rates of HIV and AIDS diagnoses are highest in the South. Southern states account for half of new HIV diagnoses in 2015, while making up 38% of the national population. In the South, 23% of new HIV diagnoses are in suburban and rural areas, and in the Midwest, 20% are suburban or rural as well, which are higher proportions than in the North and the West. The South's larger and more geographically dispersed persons living with HIV creates unique challenges for prevention, treatment, and care, because the South lags behind other regions when it comes for HIV prevention and care indicators. Okay, so relevance to the HBU community. HIV affects the HBU community in different ways. From a student's aspect, our college campus could be at risk of contracting the disease because young adults may participate in things like unprotected sex and illicit drug use. And it's not just the students as well. The school staff and faculty alike can contract the disease in the same way that the students could as well. From a nursing school standpoint, student nurses and preceptors could be at risk of getting the virus because of close contact of HIV patients. So when I say that, it's when the student nurses are caring for the HIV patients in general in their care. They can accidentally puncture themselves with needles that they use from the patient, or they can come into contact with the patient's blood or bodily secretions. The same thing would go for student nurse preceptors while they're helping the student nurse with the care, or while they're just evaluating the student nurse in their care, and then those things happen to them as well.
So human immunodeficiency virus, HIV, is a retrovirus that causes AIDS. This virus attacks, damages, and weakens the immune system, not allowing it to fight organisms that cause disease. It is a chronic, potentially life-threatening condition. So clinical manifestations. A primary infection will be acute HIV, and it has the flu-like symptoms. They include fever, headache, rash, sore throat, muscle aches and joint pain, swollen lymph nodes, malaise, and nausea and diarrhea. Since they're flu-like symptoms, they can go unnoticed, and they start within a month or two of contraction, and they can last for a few weeks. The next one will be clinical latent infection, which will be chronic HIV. The main manifestation for this one will be swollen lymph nodes. If the HIV goes untreated, this phase can last about 10 years, but with treatment, it can last for decades. The next one will be progression to AIDS. So during this phase, you may feel soaking night sweats, recurring fever, chronic diarrhea, persistent white spots or unusual lesions on tongue and mouth, weight loss, and skin rashes or bumps. So this one takes about 10 years without treatment, and by this point the immune system is really damaged and weakened. So as soon as you start feeling any of these manifestations, just go see a doctor. It's always better to find out that if you do or you don't have it ahead of time. Okay, so risk factors include unprotected sex. That means having intercourse without condoms and having multiple partners. Having other STIs also causes open sores in the genitals, and that increases the ability for the HIV virus to go into your body. The IV drugs, when you share needles, you have a higher risk of the other person. Damn it, I'm starting over. You're gonna cut that off. Okay. Risk factors. Unprotected sex, that includes not using condoms, and then having multiple partners. Both of those have a high risk. No, I don't know what I'm doing. I try to make it flow, but I need to pause myself.
No, you were good. You could have just stopped and then stopped for a while.
Okay, so for HIV diagnostic testings, they usually do testing for HIV antibodies and antigens in the blood. So this can be done on the blood or oral fluid specimens. Nowadays, they also have home kits where you could do it at home, but that would have to be followed up by a real test at the hospital. To monitor for the progression, they usually look at your CD4 T cell count, and your normal is 800 to 1200 cells per microliter. The less CD4 T cells you have, that means the worse the HIV is. Then they also look at your viral load, and these are reported as real numbers. Decreased viral load means that the disease is less active. Also, if you get a positive antibody test, it has to be followed by a Western blot test for confirmation. Lastly, for AIDS, it's considered AIDS once your CD4 T cell count gets lower than 200. You have one opportunistic infection or cancer. You have the wasting syndrome or AIDS dementia. Any one of these could, if you have one of these, basically it counts as AIDS. Okay, so for complications, there are many complications just because HIV people have a lower immune system. So one of the common ones are thrush, shingles, oral or genital herpes. You also get a lot of bacterial infections and Kaposi sarcoma. You might also get oral hairy leukoplakia, which are all over your mouth. And for other diseases, you might get TB, hepatitis, numerous STIs, liver and kidney damage, and also urinary tract infections. And also, as your HIV gets worse, of course, this could lead to AIDS, which I talked about the symptoms earlier. So is HIV contagious? Yes, it is. You could get it with contact with any blood, semen, vaginal secretions, and breast milk of the infected person. So obviously you could get it when you have unprotected sex with an infected partner, exposure to HIV blood and blood products, maternal transmission, so your mom to fetus, also when you're breastfeeding and you have HIV. And your chance of contracting it depends on the duration and the frequency of your contact with the infected person, the volume and the concentration of the organism, and also the host's immune system. That's it.
So transmission. It's not spread casually, so you cannot get it from kissing, sharing utensils, saliva, coughing, sneezing, anything like that. You have to be exposed to their blood or their sexual fluids. And because of this, healthcare workers are actually at a pretty low risk for getting it even after being stuck by a needle, because it requires a constant exposure and a large amount of the viral load in order to fully develop it. The most common mode of transmission is sexual contact, particularly the person on the receiving end. And that's about it for transmission. So how do we prevent it? Various methods for protection. It has about a 90 to 100% success rate. For the male condom, it's pretty much 100. For the female, it's around 90. But if you use both, that's even better. Do not share needles if you're an IV drug user. And the best way to prevent this from even happening is to stop taking drugs altogether. There's support programs out there for you, and you can get help. Do not have intercourse while under the influence. Being under the influence just increases your chances of doing something stupid and risky, so just avoid doing anything like that. And also, get screened. Your routine yearly physical, get tested. If you're active, get tested. Getting tested always helps you prevent it from going into full-blown AIDS and helps you identify and treat it earlier. Alright, so for the drug therapy, it's called antiretroviral therapy. And this is because the HIV virus is a retrovirus. So drug therapy is very extensive and you have to take a multitude of medications. And each medication targets something specific. So the virus needs certain enzymes in order to replicate. And that's transcriptase, protease, and integrase. So you'll need an inhibitor for each enzyme in order to fully stop the replication. Now, there are also combinations of certain drugs that you can take, but it's also going to be hard to manage. So organizing yourself by getting pill organizers, calendars, or even apps to help you remember to take your drugs is important because of the drawbacks. Well, first of all, this is extremely expensive, so not everyone can afford this. So having good insurance is vital, but not everyone has that, so that's a topic for another day. But you need to have strict adherence to your medications because the virus can become severely drug resistant. Even missing one dose of your medications can make it resistant. And if you're only taking one of these medications and not the others, you're going to be resistant. So you have to take all of them at the same time. A problem for some people is some of the side effects can be practically intolerable. So some people will not take one medicine because, oh, that makes me throw up all the time. No, you have to let your doctor know as soon as possible if you are unable to take a medication because of the side effects, because there are different ones that you can take and you don't want it to be resistant. So you have to make sure that you're able to take medicines that are right for you. So don't be afraid to call your doctor and be like, hey, this one isn't working, what can I do?
Okay, so as for emotional effects of being diagnosed with HIV, when a person is first diagnosed with HIV, it's devastating to them. They have anxiety, depression, fear, they're in denial, they feel hopeless, they're angry, and they may even feel guilty that they might have brought this upon themselves. And this can be so stressful for them because this changes how they run their lives. They have to make difficult choices in treatments and change their life routines. This makes a person feel lost and powerless. With all this, there is a certain stigma associated with HIV, and this discrimination against people with HIV, and this leads to people feeling isolated. But just so you know, discrimination against a person for their race, their gender, for their ethnicity, and even a disability such as AIDS, HIV is illegal. And so I would suggest if you do find yourself in that position to go to ada.gov and read about the anti-discriminatory laws and how to file a complaint against a company or other places that may have excluded you. Now, as for mental health and drug abuse, like I said earlier, this causes so many emotional conflicts for you when you're diagnosed with HIV. And some people who get HIV are already drug users. Maybe that's how they got it, because they were sharing needles. For this, I suggest that you go to findtreatment.samhsa.gov for more information to talk to someone about drug abuse and mental health. This is a program that is open 24/7 and is open to anybody. Okay, so as for resources, the resources that I found, which was very easy to find, I just put it into Google HIV resources, and there's a variety of things listed on lists. But what I found mostly was for healthypeople.gov. This is Healthy People 2020, which is a government-based website and program that informs people about preventing illnesses. And one of the things that I found on this website was a medication schedule that helps people stick to their medication. Like we said earlier, the medications are very expensive. They have a strict schedule, and some people just miss the medication by accident or just don't take it because it's too hard on their lifestyle. But what I found was there's actually an app called Every Dose Every Day, and this is an app that you download on your smartphone. It's through Android and Apple, and it helps you know your schedule, make sure that you take your medication on time because that's the best thing for you. I also found HIV.gov, which is a website where you can ask common questions like, what is HIV? How can I get it? What are my risks? Where can I find help? And then there's also the CDC, which has a big old list of resources for you. There's actually a hotline. For Texas, it is 800-299-2437. with this, you can actually talk to someone and ask any questions you may want to ask about HIV. And there's also an online support system through thebody.com where you can attend a forum and talk to people who have HIV and are going through the same things you are. Through the CDC and a bunch of other websites that are found, you can find HIV testing sites just by inserting your zip code. So there's no reason why you shouldn't be able to find somewhere near you. Okay. Okay, so what I also found is that there are a variety of campaigns that are related to HIV and AIDS. There are awareness campaigns such as Let's Stop HIV Together. This campaign brings awareness to HIV and tries to lower that stigma by stating that anybody can be diagnosed. It could be your mother, your father, brother, sister, siblings, friends, family. So there's no reason to be prejudiced about it. There's also testing campaigns called Doing It, which is a campaign that encourages all adults to get tested. Their motto is, he's doing it, she's doing it, we doing it, you should do it too, get tested. There are prevention campaigns, one called Start Talking, Stop HIV. This campaign is encouraging people to talk about HIV, such as not being shy about speaking this with your partner that you are intimate with. Talk about using contraception, such as condoms, and talk about getting each other tested before being intimate with each other. It's one thing that should be talked about. Another campaign is care and treatment. One of them is called HIV Treatment Works. This encourages people to get the care they need, stay with that care, and live healthier lives. Lastly, there is a provider campaign which takes away all that stress from the individual and focuses on the provider. This campaign encourages providers to screen all their patients, help patients identify risky behaviors. This campaign is called Prevention is Care. For example, OB doctors should be screening every pregnant patient they have for HIV so that they don't transmit it to their babies. Okay, so for rehab and long-term care. So with the availability of so many treatments and services to people diagnosed with HIV, they are living longer with their diagnosis, and so we're going to have a sharp increase in the geriatric population who are diagnosed with HIV. They are susceptible to the same diseases as anybody else, such as heart disease, kidney disease, bone disease, diabetes, hypertension, and cognitive deficits. But they do have a higher rate of comorbidities such as these because of the side effects of their HIV medications. Though they do get these as they get older, they may experience these at a younger age. What you may see now, people getting these diseases at 60 and 70 years old, you now see them at 40 and 50. As for long-term care, assisted care facilities should be able to care for these patients like any other patients, but they should also accommodate to them according to their needs as HIV patients. Sadly, however, some are facing discrimination, still seeing that often as they're seeking living arrangements and long-term care services. Long-term care providers may have very limited knowledge about HIV or be unaware of their legal obligation to provide housing and services to individuals living with this disease. Knowing your rights will help ensure that you receive the same respect and care afforded to others. There is this link that I found. It is a published article from landalegal.org that gives you the knowledge you need about your rights to assisted living and how to get them. Because you are like anybody else, you deserve what everybody else gets. There is also hospice. Like anybody else, you deserve to end things comfortably and with the appropriate care. Okay. And that is all that I have right now. Okay, well, thank you for listening. That ends our presentation. I hope you learned something from this. Last thing I just want to say is everybody get tested. That's the best thing you can do. Thank you.